Welcome. I would like to begin today by respectfully acknowledging that UBC Okanagan is situated on the traditional, ancestral, and unceded territory of the Silks Okanagan Nation. I would also like to acknowledge that many of you are joining us from places afar and acknowledge the traditional owners and caretakers of those lands. My name is Jen Jacoby, and I am the Director of the Institute for Healthy Living and Chronic Disease Prevention. And it is my pleasure to welcome you to the 12th Annual Okanagan Embrace Aging Month. Thank you for joining us today. Embrace Aging is co-hosted by Beem Credit Union, Interior Health, and the Institute for Healthy Living and Chronic Disease Prevention here at UBC Okanagan. It's hard to believe, but I'm very proud to acknowledge that Embrace Aging Month was launched 12 years ago to celebrate and raise awareness about positive aging, and has once again organized a number of educational opportunities and events during the month of March to support older adults and their families. The sessions are designed for everyone, young and old alike, and focus on a variety of topics related to healthy aging and ways to improve quality of life for older adults, their family, and their caregivers. Our goal is to inspire everyone to embrace positive aging. Now, before we get underway with our speaker, I want to identify a few kind of Zoom room aspects in case you're unfamiliar with them. The first one is closed captioning. You might have a little box floating around your screen with the words coming out that I'm saying. If you don't want to see those words, to turn off closed captioning, select the Hide Caption button on the menu bar and the box will go away. Questions. We look forward to questions, and our speaker looks forward to addressing them at the end of the talk. So please put your questions in the chat box. They'll be read at the end and addressed by Dr. Jen Bolt. Now, feedback for this event, please complete the survey. We will email you one following the event, and we really want to know your thoughts, not only about today's talk, but about Embrace Aging or what the Institute can offer you moving forward. Now, today's session is entitled 10 Lesser Known Ways Your Pharmacist Can Help You Meet Your Healthcare Goals. It is my pleasure to introduce our pharmacist here, that's part of the Aging in Place Research Cluster and a member of UBC and the Interior Health, Dr. Jennifer Bolt, who's the Research and Development Pharmacist for Interior Health. Jen, I'm going to turn it over to you now.
Thank you, Jen, for that introduction and for the opportunity to speak today at this Embrace Aging event. I am a pharmacist by trade. I live and work in Kelowna. In Kelowna, I work at the Central Okanagan Seniors Health and Wellness Center, which is an interdisciplinary ambulatory care clinic that specializes in the care of older adults. I also work for UBC Vancouver for the Faculty of Pharmaceutical Sciences, where I teach our next generation of pharmacists. And today I am really pleased to be speaking about ways that you can really utilize the expertise and knowledge of your pharmacist to meet your own healthcare goals. There we go. So for the topics we're going to cover today, we will talk about some of the traditional roles of a pharmacist. We'll talk about some of the recent changes to our pharmacist scope of practice over the past few years here in BC. We'll talk about ways we can utilize our pharmacist knowledge and expertise to really optimize and individualize our medications, how we can utilize pharmacists to help self-manage our medical conditions, and we'll close by talking about the intersection between climate and prescriptions and how we can utilize our pharmacists there as well. So when we think about pharmacists, most of us probably think about our pharmacist who's working in a community pharmacy, a Shoppers, a PharmaSave, a Costco, or an independent pharmacy. And they're filling roles such as dispensing your medications, compounding medications for you, ensuring that your medications are safe with your other medications, and providing you education. And this is a role that about 70% of the pharmacists in BC fill is in a community setting. The other 30% of pharmacists work in a variety of settings. Some work in the hospital where they work alongside your physicians, nurses, physiotherapists, and respiratory therapists, and other allied health professionals, where they interact with your medical teams on patient care rounds to really optimize your medications within a hospital. Some work in long-term care facilities where they're involved in medication reviews once or twice a year for all of the clientele of those long-term care facilities. More recently, pharmacists have started working in primary care networks. Our primary care networks are groups of allied healthcare professionals, including nurses, social workers, physiotherapists, dietitians, and other healthcare professionals who all work alongside your family physician to optimize the care of all the patients within the family physician's practice. And a small number of pharmacists will work at the university doing teaching and research, and some will work for the government doing consulting or providing advice on drug availability and drug coverage. Over the past few years, there's been a few changes to the pharmacist scope of practice within BC, and we'll talk about each of these three changes. The first change that we'll talk about is pharmacist prescribing for minor ailments. So pharmacists were granted this authority June 1st, 2023, to prescribe for a discrete list of minor ailments. And what is a minor ailment? Well, a minor ailment is a common, uncomplicated condition that is typically self-limited. It typically will resolve either on its own or with a short course of a low-risk treatment. On the screen, you can see the specific minor ailments that pharmacists are allowed to prescribe for. Over the first year that pharmacists had this authority, I'm really pleased to tell you that over 430,000 British Columbians sought out pharmacists for this service of prescribing for minor ailments. And that included pharmacists working at 92% of the community pharmacies across the province. And I'm really pleased that this seems to be a service that is available anywhere in the province, wherever you live. If you do have one of these minor ailments and need assessment and prescription, your pharmacist will be there for you. The most commonly prescribed minor ailments by pharmacists tend to be urinary tract infections, allergies, dermatitis like skin rash, or conjunctivitis, which is a eye infection. But when I look at this list of minor ailments and think about our older populations, I think there's probably two minor ailments that stick out to me as really important to know that your pharmacist can prescribe for you. And those include urinary tract infections and shingles. So we know that unfortunately, as we get older, some individuals are at higher risk of urinary tract infections. And if they're not treated early, those urinary tract infections can become complicated and can even lead some individuals to be hospitalized. So knowing that our pharmacists can prescribe for urinary tract infections, it just makes treatment a lot more accessible so that we can get treatment started really quickly if we are experiencing a urinary tract infection. And then shingles is another one that I think is really important to know that your pharmacist can prescribe for this. Shingles is the chickenpox virus that becomes reactivated in our body later in life. And shingles is really common. 1 in 3 people over the age of 50 will develop shingles in their lifetime if they are not vaccinated against shingles. And shingles is a condition that if we can get on top of treatment really quickly, like within 24 hours, we can abort the shingles and prevent long-term complication of shingles, like long-term chronic pain. So again, knowing that a pharmacist can prescribe for this becomes really valuable. The pharmacist prescription assessment, I just wanted to touch on what that looks like so that you can understand what that assessment might entail. Pharmacists have a very standardized algorithm for each of the minor ailments that they can prescribe for. We'll ask you questions about the condition, about your signs and symptoms so that we're sure that we're treating the right thing. Will I ask you questions about yourself and your medical history to make sure that there's nothing about you that maybe is more complicated than what we as a pharmacist can prescribe for. If there are some things that are a bit more complicated about you, your medical history, or how you're presenting, we'll refer you on to a physician or nurse practitioner for a more thorough assessment. We'll identify if there are prescription or non-prescription options for you. And if appropriate, we'll provide you with a prescription. That prescription does not need to be filled at the pharmacy where it is written. You can fill that prescription anywhere in the province, and it will be billed to PharmaCare or your drug coverage plan and paid for the same way it would be as if the prescription was written by a physician. We also will notify your family physician or nurse practitioner that we assessed you and gave you a prescription, and will provide follow-up to you to ensure that your symptoms have resolved. When I think about the benefits of utilizing pharmacists for minor ailments prescribing, to me, it's really about timely assessment and management of these conditions. Most of the time when we have things like a urinary tract infection, shingles, maybe allergies or rashes, we're often utilizing our urgent primary care clinics or our walk-in clinics, where sometimes we can wait for a number of hours to be assessed. By allowing pharmacists this ability to prescribe for minor ailments, it's just making treatment way more accessible for British Columbians. You might have looked at that list and said, well, I have some of those things on the list and I just treat those with a non-prescription medication. I don't talk to my pharmacist about management of my strain, sprain, or my headaches. I think the benefit of talking to a pharmacist about your minor ailments is really threefold. One, they'll make sure that whatever medication you're using is safe with your existing medications and medical conditions. They'll identify if this is something you really need to see a physician about and refer you on if needed. And three, sometimes the pharmacist can bill those non-prescription medications as a prescription to your medical plan and get them covered. There has been some research looking at the benefits of pharmacists prescribing for minor ailments, and generally it's found that there tend to be quite high cure rates, which are in alignment with the cure rates of physician prescribing for these minor ailments. Pharmacists are really good at following standardized algorithms. So literature suggests that pharmacists prescribing for minor ailments is in accordance with clinical practice guidelines 95% of the time. And there tends to be a high level of patient satisfaction when using this service. So to see a pharmacist for minor ailments, walk-in service is available at a number of different pharmacies across the province. But if you want to book an appointment online, you can do that at bookapharmacist.gov.bc.ca. So the next of the newer scopes of practice of pharmacists is ordering, interpreting, and receiving lab tests. So this was an authority that was granted to pharmacists as of August 31st, 2024. And states that pharmacists now have the ability to order, receive, and interpret lab tests. I think this information becomes really critical for pharmacists to really help you to optimize your medications. So we know that a number of medications, as an example, are removed either through our kidneys or our liver. And as we age, sometimes our kidney function changes or our liver function changes. So by allowing pharmacists to order and receive lab tests or access lab tests, this means that pharmacists can check all your medication doses, make sure that they're all dosed appropriately for your kidney function and renal function, or adjust the medication doses if needed. We also know that a number of our medical conditions, in order for us to tell if they're well controlled, we need to look at labs. Think cholesterol numbers, for diabetes or blood glucose numbers, or maybe our thyroid levels. All of those conditions are really assessed through our lab tests. So by allowing pharmacists access to lab tests, our pharmacists can tell if our medical conditions are well controlled, or if we need to add a new medication or change the dose of a medication. And finally, we know that some drugs cause side effects that are really only accessible by lab tests. So I think here about our medications that maybe impact our electrolytes. They cause our sodium to be high or low, or our potassium to be high or low. By granting pharmacists access to the lab tests, this allows pharmacists to make timely monitoring of your medication to make sure that all your medications are safe. Now, I will give you the caveat that within our pharmacist scope of practice, lab ordering has to be around optimizing medication management. So there may be a number of lab tests that your physician can do to maybe monitor other medical conditions, but pharmacists have a more strict list of lab tests that they can order that are really focused on our common medications that are utilized. So what does it look like when our pharmacist orders our lab tests? Well, our pharmacist will write out a lab requisition similar to a physician one, and it will be covered by our medical services plan or by the government, similarly to if it was written by a physician. We know that not all lab tests are covered by MSP, but if a lab test would be covered, if our physician wrote the order, it will be free if the pharmacist wrote the order as well. It is important to note that when a pharmacist measures your lab test, the lab results are sent back to that pharmacist. They are not automatically sent back to your family physician or other healthcare providers. So it does become important if you want the lab test to go to your family physician or any of your specialists, you just need to ask the pharmacist and they can copy the results to any healthcare professional in the province. After receipt of the lab test, so after it is sent back to the pharmacist has 3 specific duties that they must do. They must inform you of the test results. Even if the test results are normal, they need to make sure that you know that the test results are normal. They need to utilize the lab results to review your medications and make sure they're all dosed appropriate and whatnot. And if your lab results are abnormal, they need to provide you guidance on what to do. Sometimes that is just changes in your diet or your lifestyle. Maybe it's eat less salt or eat less bananas. Or sometimes if the lab results are really abnormal, they might need to refer you to, say, a walk-in clinic or the emergency department. So when I think about the benefits of pharmacists ordering lab tests, I again think it's really about your accessibility to healthcare. I think this becomes particularly important for the many British Columbians who do not have a family physician or a nurse practitioner. Sometimes when we are using walk-in clinics and urgent primary care clinics to meet our medical needs, we miss out on some of the regular monitoring of lab tests that can really help us to optimize our medications. And our pharmacists can help with that by ordering some of these tests to help assess your medical conditions. There's also a few different vitamins that we can measure the levels of. So we can measure levels of things like iron and B12. And generally, I say before we start supplements like iron and B12, we should know if we're deficient in them. And your pharmacist can help with that by checking your iron or B12 levels. And similarly, if we start a supplement for something like iron or B12, it's important to know if the supplement that we started is sufficient to replete our stores. So our pharmacist can help with that as well in checking your levels to make sure that they have repleted. And again, our pharmacist will refer you to a physician if it is necessary based on the lab tests. To access lab monitoring by a pharmacist, typically the request can just be made at your individual pharmacy. So the last of the newer scope of practice is injecting medications. So we know that pharmacists have been injecting vaccines for over a decade, and they've really played a critical role in our vaccine rollout. Many of us probably got COVID vaccines from our pharmacists, and every year many of us probably get flu vaccines from our pharmacists. But in 2022, there was an expansion of our scope of practice to also be able to administer medications by injection. So this would include medications that are, say, injected into the muscle, similarly to how we do vaccines, or subcutaneous injections, which are the ones that are just under the skin. Some of the common injections that we could do B12 injections or injections of medications for, say, rheumatoid arthritis. Some people with osteoporosis take an injectable medication, and some mental health medications are given by injection as well. Now, I will note that in order for a pharmacist to do an injection, they do need to have a medication order for that. So you can't just walk into a pharmacist and ask them to give you a B12 injection. It does need to be an ordered B12 injection. Or it could be an injection for an immunization. or pharmacists can also give an injection to treat an allergic reaction or an overdose, essentially an emergency. Again, this scope of practice is really helping with access to care. For the vaccines, we have seen in the literature that when pharmacists were given this scope of practice to give immunizations, our immunization rates increased. When I think about the medications given by injection, typically, if people are on injectable medications, they either do the injections themselves or they go into their physician's office for their physician or the nurse at the office to do the injection. For those individuals who are doing their injections on their own, sometimes as we age, we lose the ability to do those injections on our own. Maybe we develop, say, really bad arthritis in our hands and we can't manipulate the syringes anymore to do the injections, or maybe our eyesight changes such that we can't see the injections very well to safely administer them. And those are great times that we could talk to the pharmacist about taking over that role. Similarly, if it becomes difficult accessing your physician's office or a nurse at your physician's office to do the injection, again, your pharmacist can take on that role as well. Most of the pharmacies, as you've probably seen, have an online system where you can book vaccines. If you're wanting the pharmacist to inject your medication, that request is usually best made at the pharmacy itself, either when you're dropping off or picking up your prescription. So the next thing I want to shift to talk about is how we can utilize the skill set of the pharmacist to really individualize and optimize our medication regimens. So we'll talk about identifying if all our medications are actually still needed, ensuring that our medications are in alignment with current clinical practice guidelines, education, creating plans to stop medications when needed, and enhancing our ability to take prescriptions as prescribed. So we know that medications are very common as we age. In Canadians over the age of 60, about 80% of them take at least one long-term medication. 30% of them take 5 or more medications, and 25% will take 10 or more medications in a year. The most commonly prescribed medications to older Canadians tend to be ones for chronic conditions like cholesterol medications, blood pressure medications, or diabetes medications, as well as pain or reflux medications. So when I see patients, they often ask me, well, why would my medications not be needed now? I've been on medications for years. What has changed now that I don't need these pills anymore? Or that my pills need to change? Well, there's a number of reasons that our pills might not be up to date anymore or might not be the most safe or effective medications for us anymore. Our bodies change with age. We might have started a medication 30 years ago, but our bodies changed over those 30 years. And now maybe our kidneys and our liver aren't working as well to eliminate medications quite as well. And maybe we're at risk of accumulating the drug. Our bodies change in relation to their muscle mass, their fat content, and their water content. And that can all change the concentration of medications within our system. We can even have changes in what's called our blood-brain barrier. That's the barrier between our blood and our brain that medications need to cross in order for them to have good or bad effects on our brain. And this blood-brain barrier does become more permeable as we get older, increasing the risk of things like brain-related side effects, things like confusion or memory impairment. Some people are really surprised when I tell them that they may be taking a medication long-term, that if we read the clinical practice guidelines, don't recommend long-term use of that medication. So a few examples of that. If we read the clinical practice guidelines for medications for reflux, they actually state for most people with reflux, we should try stopping the medication after 8 to 12 weeks of therapy. That's typically not what happens. I typically see those medications prescribed for years and years and years, but guidelines actually don't recommend that. Similarly, for patients with dementia and certain behaviors of dementia, the dementia guidelines recommend that after we get control of those behaviors, we should actually try tapering that medication within about 3 months because there are long-term complications of use of that medication. Sometimes our treatment targets, like the blood pressure that we're trying to achieve or the blood glucose level that we're trying to achieve, sometimes those targets change with age. And those targets might change based on the other medical conditions that you develop, what your age is, or if you develop frailty. We know from the literature that targeting a really aggressive blood pressure and blood glucose in frail older adults can actually be more harmful than helpful. So as we age, we do need to make sure that we're revisiting those targets and liberalizing them if that's the best option. And finally, new medications come to market all of the time, and your pharmacist certainly knows about all the new medications that are coming to market. As an example, for diabetes, they see lots of people who've been on their same diabetic regimen for 20 years or 30 years. And there's actually been an explosion of new medications for diabetes over the past 10 years, some of which are safer and many of which are more effective than the older medications at reducing the complications of diabetes. So our pharmacists can be really helpful in reviewing our existing medications against what's new and potentially better. I wanted to touch on polypharmacy, and polypharmacy is defined as an individual who uses 5 or more medications at the same time. And we saw that is about 30% of Canadians over the age of 60 use 5 or more medications concomitantly. Why do we care about using multiple medications? Well, literature tells us that those people who take 5 or more medications are higher risk of side effects, drug interactions, falls, memory impairment, or being hospitalized or admitted to a long-term care facility. Now, not surprising, one of the primary reasons we develop polypharmacy is because we develop multiple medical conditions. The more medical conditions we have, unfortunately, the more medications we need to take. But one of the other really prominent risk factors for polypharmacy is not having a primary care provider, so not having a family physician or nurse practitioner. You're essentially missing that quarterback of your care who's trying to align all of the different recommendations from different specialists and different providers and making sure there's no duplications or things that are no longer needed. The other place we can contribute to polypharmacy is when we just automatically refill medications without actually reviewing if they're necessary. And that falls on everyone in the health system. Falls on the prescriber, who's just sometimes just refilling medications, falls on the pharmacist, who's just refilling medications or asking for refills of medications. And sometimes the patients can contribute as well when they just ask for, I need more of my medications, without going through the process of medication review. And that medication review becomes really important to help us to identify if medications are unnecessary. Research suggests that across Canada, approximately 10% of chronic medications are unnecessary. Doesn't mean that they're harmful, they're just not necessary for individuals. And so if we can identify unnecessary medications, we can target deprescribing. Deprescribing can be defined as the purposeful tapering or discontinuation of a medication with a goal of improving your health. Some medications can be abruptly stopped with no problem. Others, if you abruptly stop them, can cause withdrawal symptoms or worsening of a medical condition. And so for those medications, we need to design a tapering regimen. Your pharmacist becomes really crucial when you're designing tapering regimens, because tapering regimens tend not to be standard, i.e., they are not the same for every individual we're trying to get off of a medication. They'll depend on the medication, the dose, and how long you've taken it, the reason you're taking that medication, and what your current symptoms and side effects are, if you've tried stopping that medication before, and if you have any other medications that you're currently taking. And so with the knowledge that pharmacists have specializing in medications, they're really able to tailor that tapering regimen to the individual patient. So I think if you're ever thinking about stopping your medications or planning to stop your medications, whether or not that's in conjunction with a physician or nurse practitioner, I think it's always beneficial to talk to your pharmacist. They can help to ensure that your tapering plan is individualized to you and your medications. They'll also review all the other medications that you're taking and make sure that tapering this one doesn't impact other medications. We know there are lots of drug interactions that can happen, and drug interactions can even happen as we take away medications. If there was two interacting medications that were relatively stable, when we take one of those medications away, it could cause problems with the existing medication. So your pharmacist can check on that for you. They can provide you education on what symptoms might emerge, whether it's a withdrawal symptom or recurrence of your medical condition, and how to manage those symptoms, as well as they can update that tapering plan based on how you do as you reduce the dose of your medications. So the next way we can utilize our pharmacists is really ensuring that we are fully informed about our medications. I know pharmacists typically do a really good job when you first get a medication about telling you the purpose, how the medication is, how to use the medication, what to expect in the way of benefits as well as side effects. But from my experience, not everyone remembers that for their whole length of therapy. If you've been on a medication for 20 or 30 years, you might not remember all of that initial information that was originally told to you. And sometimes as we accrue multiple medications, it becomes more difficult to really extract specific information about specific medications. Beyond kind of those general education pieces, I think it's also important to ask our pharmacist about how long am I supposed to be on this? Like, what's the intended length of treatment? And if and when someone might consider stopping this medication. That empowers you with the knowledge of, oh, this is a lifelong medication, I'm going to be on it forever. Or this is a medication that's typically given for eight weeks or 1 year or 5 years, and then I might be able to discontinue that medication. Empowers you to be able to have those conversations with your medical providers about the duration of therapy. As I alluded to, our understanding of our medication is influenced by a lot of factors. I find that the more medication someone takes, the less likely they are to tell me, as an example, be able to tell me the reason for every single medication that they take. If your medical team is frequently changing your medications, like adding new ones, taking some away, increasing or decreasing dosages, that can lead to confusion around your medications. And memory impairment can certainly impair our memory and knowledge about our medications, and how independent we are with administering our own medications. So if, as an example, a nurse comes in and administers our medication, we might be less likely to know what they're administering. And similarly, I find that individuals who have their medications prepared in blister packs tend to be a little bit less knowledgeable about their medications than those who are managing them out of vials. But I do think it's really important for everyone to have a really good, clear understanding of what their medications are for, when they stopped, and when they started. Because despite the fact that we would like to say that our medical record should tell us everything we need to know about our medications, we would hope that our medical record tells us what the medication was for and when it started. That's not always the case. I do find sometimes that in my care of older adults, between the patient, myself, their physician, and their medical record, no one knows when a medication started or what it was for. And that becomes really challenging when we start wanting to change that medication, because maybe it's causing problems or we think it might not be needed. But if we don't know what it's for, that really can cause some problems. So I think it becomes really important to keep an up-to-date list of your medications, including what they're for, including their start date. And your pharmacist certainly can help you to create and update that medication list. This is a poster from the Institute for Safe Medication Practices, and they advocate for asking 5 questions about your medications every time you see your doctor, nurse practitioner, or pharmacist. The first thing they advocate for us asking is, what's changed? Has anything changed with my medications? Have you added anything, stopped anything, or increased or decreased doses, and why? I can't count the number of times when working in a community pharmacy that I get a prescription for, say, an increased dose of someone's blood pressure medication, and ask the patient about it, and they say, I didn't think the dose was supposed to change. Was it supposed to change? So we can negate that confusion if you do ask those questions, because if you say, no, I asked the doctor and he said nothing's changed, then that tells me as the pharmacist, I need to connect with the doctor. Maybe there's an error with the prescription. Similarly, we should ask about, do our medications need to continue? And why do they need to continue? How long do they need to continue? How long do I need to take these medications for? And how will I know if my medication is working or causing side effects? And what do I need to look out for? Finally, we should ask, is there any follow-up I need to do, any tests or labs I need to do prior to my next visit so that we can ensure these medications are safe and effective? Finally, I think we need to utilize our pharmacists to assist us in taking medications as prescribed. The literature suggests that only about 50% of adults take their medication exactly as prescribed 100% of the time. There are a number of reasons that people might not take their medications as prescribed. Might be their cost, might be how complex their regimen is, might be a lack of knowledge about how to space things out or what can be taken together, or could be issues with their administration technique or their dexterity or their memory. Cost of medications is complex, and medication coverage is probably more complex in BC than it is in several other provinces. In BC, some of us have our medications covered by Fair Pharmacare, which sets a deductible for us that's income-based. We pay 100% of our medication coverage till we reach the deductible, and then Pharmacare kicks in and pays 70%. But there are some exceptions. There are some other pharmacare plans that cover, as an example, certain kidney disease medications or mental health medications or cancer medications. Sometimes we need to have physicians submit special authority for a medication in order for it to be covered. And some people have private medication coverage as well. Our community pharmacists are really experts in medication coverage. They can help you to determine if you're registered with Pharmacare. They can give you guidance on how to check your Pharmacare deductible so that you know what you have to pay 100% of before the Pharmacare kicks in. And if you have, if your income has changed over the past few years, Pharmacare can also reassess your deductible to see if it can be lowered. If you have trouble splitting your paying for the deductible upfront at the beginning of the year, Pharmacare can help you to have that deductible split across the year. Your community pharmacist can check if special authority is needed, if it's been submitted, and if it's been approved. And if the medications are too costly, they can look at lower cost alternatives that may do the same thing but cost less money. Medication complexity also has a big role in how well we're able to take our medications as prescribed. The more complex a medication regimen is, the more likely it is we're not able to be 100% adherent. And that complexity is dependent on how many medications we take, how many times per day and how many doses per day we have to take of our medications, how we end up spacing those medications throughout the day. If we're between our medications and vitamins, if we're taking medications or vitamins every 3 hours, that can get quite complex. As well as sometimes the dosage form and the administration instructions can add complexity as well. Our pharmacists can be really helpful in simplifying these regimens. I have a lot of people who tell me, I'm great with the morning pills, I'm great with the evening pills, I never remember my midday pills. I'm just out and about, doesn't work. Well, that's great because we can work on the regimen to figure out, can we make some changes in either the dosing or the medications such that we can just get you on twice-a-day medications and you only have to take them in the morning or the evening. Similarly, I have people who say, I am fantastic taking my morning pills, but half the time I forget my evening pills. Okay, well, let's work on that to see if maybe we can change your regimen so that you only take morning pills. I find there's also sometimes some misunderstanding about what medications can be taken with which vitamins or supplements, which can add to an unnecessary complexity. Sometimes what we end up doing is just saying, well, there's no interactions between these medications and these supplements, so just take them all at the same time. And finally, our pharmacists can be really helpful in ensuring we have the proper technique of all our medication devices. So we know a lot of medications have a specific technique for administration. Think our inhalers, our eye drops, our nose sprays, things like that. And if we're not using the medications properly, we're not going to get the full benefit of them, and we might be a higher risk of side effects. So if we take inhalers, for example, patient adherence with inhalers has been studied, and it's been found that only about 20% of people who chronically use an inhaler follow all of the steps all of the time. Sometimes we take shortcuts and skip a few of the steps with our inhalers, or maybe we just don't remember the steps of the inhalers, or maybe our dexterity is such that we can't really use that inhaler anymore. And for inhalers, literature has suggested that if we don't have good technique, we're actually at a higher risk of having an exacerbation of our lung disease, like our asthma or COPD. So review of our device technique with the pharmacist can be really helpful. I generally say, yes, our pharmacist will tell us about how to use the devices the first time we fill them, but we should be reviewing that technique on a yearly or every few year basis, just to make sure that we haven't forgotten or are missing any of the steps. Finally, assistance with medication administration. So there are a number of different pill organizer devices. We have the pill boxes, or we have blister packs, or we have medication dispensers as well. All of these are designed to help us to remember to take our pills. Unfortunately, as we get older, remembering our medications is one of the things that can lapse. We become less able to remember that we're intending to take medications in the future, like I'm intending to take medications at bedtime, and less able to remember if I actually took my medications earlier today, or am I just thinking about yesterday when I took my medications in the morning. So these type of devices help to organize your pills so that you can see if you've taken your pills today. The pill boxes, you load those on your own, and they'll have morning slots and evening slots, and they'll have a 7-day pill box. With the blister packs, the pharmacist will prepare those for you. And I find one of the benefits of the blister packs is the pharmacist will keep an eye on things like your refills so that you're never going to run out of a medication. They'll tell you when you need to go back to see your physician for a refill, or sometimes they'll ask the physician for a refill for you. The last one most people or many people don't know about is the automated pill dispensers. This is a machine that the pharmacy will load your prescribed pills into, and you can program what time the pills will pop out of the machine. So you can time, every half an hour if you wanted, but you can set the times that I want to take my pills at 8, at noon, and at 5 p.m. And at those times, the machine will pop out your pills, and you'll have some sort of notification, usually an auditory notification, that it's time to take your pills. And it will record that your pills have been taken. So again, it's just another way of organizing the pills and making sure that you're taking them as prescribed. So next, I just want to talk about utilizing our pharmacists for some of the self-management of our medical conditions. So the first thing I wanted to talk about is advice on vaccines. So we know that pharmacists give vaccines all the time, but I don't think we ask pharmacists enough about what vaccines are recommended for me. When I think about the care of older adults, there's 6 different vaccines that tend to be recommended. The flu vaccine, COVID vaccine, the pneumonia vaccine, shingles vaccine, the RSV or respiratory syncytial virus vaccine, and tetanus. These vaccines, some of them, the recommendations change over time. As an example, the COVID vaccine recommendations just changed as of February 2025, and they're now recommending that individuals over 80 or in a long-term care facility get 2 COVID shots per year, and individuals over 60 who are not in a long-term care facility get at least 1 COVID vaccine per year. But that's really new and update. A really update to the recommendations. So I think it becomes valuable when you talk to your pharmacist to get them to review your immunization status, see if there's any recommended vaccines that you're missing, and if there is, they can provide those to you. Selection of medical devices. So we're using a lot of medical devices nowadays to monitor our health. Probably the most common ones I see, blood pressure machines and blood glucose machines. And the blood pressure machines I found really took off through the pandemic because we're doing a lot more virtual care with our physicians, and we're less likely to actually have blood pressure monitored in their clinic and more likely to monitor our blood pressure at home. Our pharmacists can be really helpful when we're either selecting or using any of these medical devices. They can help you to select a device that is a good, accurate, accredited device. They can help train you on how to use the device. They can, if you've had a device for years and years, like a blood pressure machine that you've had for 20 years at home, the pharmacist can check the accuracy of the device to see if it's still good and in alignment with their device, or if you need to replace it. And they can provide you guidance on what to do if your measures are high or low. Pharmacists can also be really helpful in navigating vitamins and supplements. So we know that older adults tend to be high consumers of vitamins and supplements in Canada. Literature suggests that about 2/3 of females who are over the age of 50 will take at least one medication or one vitamin or supplement. And about 40% of males over the age of 50 will take at least one vitamin or supplement. The most common ones tend to be multivitamins, vitamin D, calcium, and omega-3s. There's also a lot of vitamins that are marketed particularly to older adults or some of the conditions that are more common in older adults. Think all the things that are marketed for arthritis or heart disease or memory impairment. And while most of them are safe, some of them can build up in the body over time, and some of them can interact with certain medications. So where our pharmacists can help here when we're thinking about our vitamins and supplements is they can help you to make sure that if there are any medically necessary vitamins or supplements, that you are taking them at the right dose. They can provide you some guidance on the evidence to support claims of benefit for some of these supplements, like the supplements for memory or whatnot. They can review your dosing of the vitamins and supplements to make sure that, that you're not exceeding the recommended amount of a particular vitamin or supplement. And they can check to ensure that your supplements and vitamins are safe with all of your medications. And finally, providing guidance on cannabis. So we know that cannabis use has been growing in all Canadians since legalization in 2018, and older adults have been the highest growing population of users of cannabis since legalization in 2018. Older adults are typically, if they're using cannabis, they're trying it for medicinal purposes like pain or sleep or anxiety. Or they might be using it for recreational purposes such as relaxation, pleasure, or socialization. And it is important to note that cannabis does have the potential to interact with certain medications and to worsen certain medical conditions. So how can your pharmacist help here? Well, they can discuss with you the research to support a benefit of cannabis for various medicinal purposes. They can provide you guidance on possible side effects, whether you're using CBD or THC. They can check for interactions with your existing medications. And there's becoming more and more guidance in the literature about actually how do we dose and how do we use cannabis for medicinal purposes. So they should be able to provide you some guidance as well about how you would actually use medicinal cannabis for something like pain. Finally, the last thing I wanted to talk about was the climate and medications. We know that our climate is changing, and in Canada, we're experiencing climate change at nearly twice the global average. And that's really owing to the vast territories of Canada with our Arctic territories and whatnot. But that's resulting in us experiencing more and more wildfires, more and more heat waves, atmospheric rivers, etc. We know that climate change is partly due to greenhouse gases, and healthcare systems actually contribute about 5% of the global greenhouse gases. When we look at the healthcare system related production of global greenhouse gases, the two primary contributing factors are medications and hospitals. Medications contribute to about 1/4 of the healthcare related greenhouse gases, and that's due to things like manufacturing, packaging, shipping, and disposal of medications. Beyond greenhouse gases, medications can also negatively impact our world by getting into our groundwater and ecosystems. And that's really due to inappropriate medication disposal. So if we're flushing our pills down the toilet or throwing our pills in the garbage can, that can introduce our medications into our groundwaters and our environments, and has been found to impact our ecosystems, plants, and animals. Not all medications are made equal. Certain medications have a greater climate impact than do others. If we think about our inhalers as an example, our traditional metered dose inhalers, like those ones that are the traditional puffers where you depress the canister and a spray comes out, those metered dose inhalers alone are estimated to contribute to about 2% of all healthcare related greenhouse gases, whereas other inhalers like the dry powder ones do not. So how can our pharmacists help here? Well, they can help us to select lower climate impact prescriptions. They can look at our inhalers to say, do you need to be on one of those metered dose inhaler ones, or is there a safe switch to a dry powdered one, which may have less environmental impact? They provide safe disposal of medications. So if you have any unused medications at home, do bring them into the pharmacy for disposal. Don't throw them in the trash or flush them down the toilet. There's a safer way for them to be disposed of at the pharmacy. They can help you optimize your medications to keep you out of hospital, because we know hospital is a big contributor to greenhouse gases. And they can deprescribe your unnecessary medications, again, decreasing the demand on pill production. But it's not just medications contributing to climate change. Medications can impact how we respond as humans to climate change. There are some medications that increase our susceptibility to heat-related illness. Some of them may decrease our ability to recognize that it's hot or recognize an increase in our internal temperature. Some will impact our ability to eliminate or dissipate heat, further increasing our internal temperature. And some will decrease our ability to maintain our blood pressure and electrolytes during extreme heat events. Some medications are also very susceptible to the heat and might need to be stored differently in a heat wave. And some of your medications may even need to be adjusted on the hottest days to improve your safety. So how can our pharmacists help here? Well, they can identify if any of your medications are contributing to worsening heat responses, if they need to be adjusted. They can help you to determine how to safely store and handle your medications on the hottest days. And they can provide you education on how you can reduce your risk of heat-related illness. So in conclusion, I'm hoping this session today helped you to identify some of maybe the ways you hadn't really thought about utilizing your pharmacist to improve your health outcomes, and hopefully triggered a few ideas in your head about questions that you might ask your pharmacist about next time you interact. So with that, Jen, I will stop my presentation, and I think I saw there was probably a few questions that popped up during the session.
You are absolutely correct. So we'll start with a few of those questions right now. So Tanya identifies and asks, we work with newcomers, including refugees, many of whom do not speak English. Do pharmacists provide interpretation services? Many prefer to go to the UPCC because they receive interpretation services there. Potentially for our audience, if you know, because I don't, if you could identify what the UPCC is as well in your answer, Jen, that would be great.
Yeah, the UPCC is our urgent primary care clinics that are dispersed across the province. And as part of Interior Health, they do have access to our provincial interpreter service, which is really one of the benefits of them going, of our newcomers going to UPCC, is they can access this interpreter service. Unfortunately, not all of our pharmacies across the province have access to the provincial interpreter service. I think it is a miss for many of them because it leaves our pharmacists relying on having a translator on hand or someone coming in with the patient who can translate for them. So Tanya, I think you've really highlighted a hole in our system.
That's great. Thank you, Jen. Now Nan asks, can pharmacists test for and or prescribe potassium, inject HRT? And then she also identifies, thanks, great presentation, and I concur with her.
Thanks, Nan. Pharmacists can measure your potassium levels, and based on how potassium is regulated, they can prescribe potassium if you are deficient in potassium. And they are able to inject HRT if you have a prescription for the HRT.
Okay, thank you. We were also asked about the recording of this presentation. I did identify that it would be available in March or into April. I did also double check the YouTube channel, and thanks to our amazing staff member who's working in the background diligently, she is getting most of them up quite soon. So it might even be as early as 24 to 48 hours, but I am not going to pressure her on that. It will definitely be within the month of March, if not sooner. And I did place the link in the chat. Now Jan identifies great info. I recently learned about an interaction between medical cannabis and my pharmaceuticals as it relates to my low blood pressure. What are some suggestions for safely raising BP?
Yeah, that's a really good question, and it depends on really, I think probably depends on a more thorough consultation than we can do in this session. Depends on your other medical conditions, where your blood pressure is, and your other medications. So I can't provide you any specifics. I do suggest that popping in to see your pharmacist and asking about that, and they obviously will have your complete list of medications to make a more personalized response.
Thanks, Jen. I have a question because I recognize a lot of older adults travel. Is there elements that you could guide them on as they travel across Canada with respect to differences that might exist province to province and how they can go about maybe accessing medication? Let's say they happen to lose it or forget it in a hotel room.
Really good point, Jen, and thank you for bringing that up. Certainly, if you're traveling across Canada, you forget your medications, go into whatever pharmacy is near you, and they can call your pharmacy and just get your prescriptions transferred directly to wherever you are in Canada. If you are in Nova Scotia, if you are in Nunavut, your prescription can be transferred from where you are in BC to anywhere in the province to be filled for an emergency refill. So just go into whatever pharmacy is there. But the other thing that brought up for me is sometimes it's really important to go in and check with your pharmacist before you travel outside of the country. Sometimes they can provide you guidance around what you need to bring with you in the way of medications, if you're traveling with controlled substances, or if you're traveling with cannabis, sometimes that can be tricky as well. So it's often nice to just check in with your pharmacist before you travel and make sure you have everything that you need.
That's perfect. Thank you, Jen. There's been many compliments about the information in the presentation in the chat. So thank you for sharing yourself and your knowledge today. I'm cognizant of time, and as we wrap up today's event, I just want to let individuals know or remind them based upon my earlier comments that you will be receiving an email following this event. We really encourage you to please send us some feedback both on today's event as well as Embrace Aging and the Institute. We do look forward to growing this event in the Okanagan and around broader than the Okanagan, if you will. So please don't hesitate to provide us with your feedback. I will leave it with you there, and thank you all for attending, and have a splendid day. If you are in the Okanagan, enjoy the last bit of snow. Thank you. Bye now.